Hi, I'm Phil Nathan, and I'm going to speak to you today about one of our awareness projects, head and neck cancer.
How important is your mouth?
You use it for lots of things.
What if you couldn't?
Mouth cancer is easier to treat when found early.
So, remember to check.
Left,
Right,
In,
Out.
Shake it all about. For more information about what to look for,
please visit our website.
So that's about the charity Head and Neck Cancer. You'll get some more details on that later. The rest of the data I'll be showing is from Cancer Research UK. A few facts and figures. New cases of head and neck cancer each year, over 12,000. Deaths from head and neck cancer each year, over 4,000. Survival head and neck cancers for 10 or more years, 19 to 59%. Prevention of cases of head and neck cancer between 46 and 88%. Some very wild figures, but you can relate more as we proceed. A little bit about head and neck cancer. Due to a lack of public awareness, unfortunately, head and neck cancer is often identified once the disease has advanced to a stage where major surgery is the main form of treatment. And surgery can cause additional complications as the head and neck is packed with vital structures. This can cause problems with sight, hearing, taste, smell, breathing, swallowing, and speaking. Head and neck cancer incidences, there are around 12,400 new cases in the UK every year. That's 34 every day. Head and neck cancer is the 8th most common cancer in the UK, accounting for 3% of all new cancer cases. And each year, 22% of all new head and neck cancer cases in the UK are diagnosed in people aged 75 and over. Since the early 90s, head and neck cancer incidence rates have increased by 34% in the UK. And the most common specific location for head and neck cancer in the UK is the tongue. Head and neck cancer incidence rates are 64% female, 101% male, higher in the most deprived quintile. And an estimated 62,500 people who had previously been diagnosed with head and neck cancer were alive in the UK at the end of 2010. So these figures are based over quite a number of years. Head and neck mortality, around 4,100 cancer deaths in the UK every year. That's 11 every day. Head and neck cancer is the 16th most common cause of cancer death in the UK, accounting for 2% of all cancer deaths. And mortality rates for head and neck cancer in the UK are highest in people 90 or plus. Each year, 36% of all deaths in the UK are with people aged 75 and over. Since the early 70s, head and neck cancer mortality rates have decreased by 9%, and over the last decade, head and neck cancer mortality rates have increased by 17%. Overall, head and neck cancer deaths in England are more common in people living in the most deprived areas. 1 in 188 UK males, 1 in 834 UK females will be diagnosed with laryngeal cancer in their lifetime. 1 in 55 UK and 1 in 108 females will be diagnosed with oral cancer in their lifetime. 46 to 88% of head and neck cancer cases in the UK are preventable, hence our awareness programme. 46% of oral cavity cancer in the UK preventable, and 88% of pharynx cancer preventable. 73% of larynx cancer cases in the UK also preventable. 64% of laryngeal cancer cases in the UK are caused by smoking, and 37% of pharyngeal cancer cases in the UK are caused by smoking. 25% of nasopharyngeal cancer cases in the UK are caused by smoking, and 17% of oral cavity cancer cases in the UK, yes, they're caused by smoking. The 2-week wait standards are met by all countries. 31-day wait is met by all but Wales, and 62-day wait is not met by any country for head and neck cancer treatments. The treatment for head and neck cancer varies for each cancer type. Between 32% and 75% of patients diagnosed with head and neck cancers have surgery to remove the tumour as part of their primary cancer treatment. Between 43% and 85% of patients diagnosed with head and neck cancer have radiotherapy as part of their primary cancer treatment. And between 8% and 61% of patients diagnosed with head and neck cancer have chemotherapy as part of their primary treatment. So who are head and neck cancer? What do they do? They're a charity founded by doctors who work directly with cancer patients, and their objectives are to minimise the impact of cancer surgery and maintain patients' quality of life. To use technology for less invasive surgery, resulting in patients having more self-confidence, faster recovery and better quality of life, and to raise awareness of the symptoms of head and neck cancer so that treatment can begin faster and result in a better outcome. HNCF have launched a procedure known as SNB, and I've been involved with charities that have helped purchase these. Sentinel node biopsy. It's a non-invasive procedure that helps to identify cancer in the head and neck. It's how NICE approved, that's the National Institute for Health and Care Excellence, for use in England. HNFC have run a successful awareness raising campaign on social media that received over 500,000 views in 2 years. HNCF know that SNB could stop 70% of mouth cancer patients from having unnecessary invasive neck surgeries. 70%. And HNCF are currently raising funds so that all UK cancer centres can use this technique. Pretty straightforward, wasn't it? Not very nice to see, but I hope it's made an impact. So how can you help? How can your club help HNCF? Use the training resources available on their website, introduce this new charity. Remember, it's all about awareness, and we can support in other ways. And all of the details that I've gone through quite quickly today in 10 minutes or so, you can pick up once this video is ready for you to download. And we'll put some slides up on the Lions website very soon after this presentation. I hope this has made you think about how simple things could be if we checked now and again. The dentist is a great place